When we cough, sneeze, talk, or even breathe, we let out little droplets of water and mucus. Some of these droplets are big and heavy and fall to the ground quickly. But some of these droplets are light and small. They flow further through the air and stay in the air for a longer period of time. These respiratory droplets contain the virus, and they are the medium through which the virus is being transmitted from person to person. Keeping this factor in mind, social distancing measures of 6 feet have been taken. But is that enough? There are 3 main factors that affect our exposure to the virus: distance, duration, and ventilation. The greater the distance between you and the person you're talking to, the lesser the chance of transmitting the virus. Similarly, the greater the time of exposure, the greater the risk of catching the virus and getting infected. Another important factor is ventilation. If you are indoors, the virus particles will stick around and increase the risk of infection. However, if you are outdoors, due to the good airflow, the viral particles will be dispersed and reduce your chance of infection. Going into the biological perspective, a virus has a protective coat of moisture around it. And if you are outdoors, there will be a lot of things acting on it like sunlight, wind, rain, and humidity, which break this protective coat and decay the virus. A recent study in China analyzed 318 different outbreaks of COVID-19 that has occurred across the entire country. Out of these 318, only one of them involved someone catching it outdoors. 1. The study still hasn't been peer-reviewed, but it is consistent as per data throughout the world. As more countries begin to reopen, more and more people are going outdoors and readjusting into their normal lifestyle. Researchers, however, propose that this step is not necessarily risky, nor is it safe. While scientists throughout the world research for a new vaccine and healthcare staff provide treatment to as many people as they can, how we handle the risk of the coronavirus is ultimately up to us. Cases have dramatically lowered in countries like China, Japan, and South Korea, which were the first countries to get infected. Though the government's proactiveness certainly played a significant role in lowering the cases, it was the people who diligently followed social distancing measures, wore masks, and washed their hands regularly that truly stopped the spread of the virus. 2020 has been a hell of a year, but ultimately it's up to each one of us to improve it. And one of the ways we can do that is through reflection.